Well, that brings up another topic which we've been on a while, but I think we need to talk about this one, the vaccine injuries. T tell us what you saw and what you heard about.
Yeah, yeah. So that was really the stick that broke the camel's back for me. So I was in grad school. I was working on the COVID floors, the telemetry floors all over the hospital throughout COVID. So for the year of 2020 and the winter of 2021, we had below normal patient admissions throughout Sonoma County. And I was being sent home because there were just not enough
Wait a minute,
patients to.
I thought the hospitals were overrun and nobody had a spare moment to breathe, but no.
No, that was never the case. And that was one of the main reasons why I was so perplexed by what was happening on the media. I didn't have TV, so I didn't see what was happening on the
Oh.
news. And then I would go to work and I would walk into my patient's room and the news would be on and my jaw would hit the floor. I was
Wow.
just so mind blown that the media was saying that the hospitals were overwhelmed and that there were all these sick people coming in with COVID. That was never the case. That was never the case. So the winter of 2020 and 2021. So this is actually a really good thing to bring forward. As an expert nurse, I've been in the field for 10 years. I was very familiar with hospital trends. So the
Hmm.
trends in the hospital are that, we have the influenza season in the winter where we have an increase in patient admissions. It happens every winter. It's normal. So, 2020, we had lower admissions to the hospital. The winter of 2020, 2021, we had normal wintertime hospital
Mm.
admissions.
Mm.
So the whole summer of 2020, the admissions levels were so abnormally low that I pretty much never had to go into work. I mean,
Is this why we were seeing all these TikToks of nurses doing dance routines? I mean,
yes.
did nobody question that? I mean, how do you say the hospitals are overrun and everyone's being worked to death, these heroic people, and then they're doing dance routines in the hospital with their protective gear, thereby wasting it? I'm
Yes.
sorry to go off on that, but well, anyway.
Absolutely. That's absolutely what was happening. So then the staff members received those COVID vaccines early on in January of 2021.
Okay.
And at that time, I had and so, I mean, that's after the whole year of 2020 when I started recognizing that hospital protocols were a violation of human ethics. The lack of administration of steroids for the most inflammatory disease process we'd ever seen, isolation of patients from their family members, those are criminal. Both of those protocols that were implemented on patients who had COVID were criminal and
Did,
charges be pressed.
didn't they also deny simple anti-inflammatories like ibuprofen?
Yeah. So
That might have
they
been state by
denied
state.
that could have been state by state. They denied steroids. That's really so
And,
there's a lab value called CRP, C-reactive protein.
mhm.
We monitored it in all patients with infectious diseases throughout my career. It's a normal lab value to assess when you have a patient who is very sick. We had the highest level of CRPs that we had ever seen in all of medicine with COVID. So when people say that COVID didn't exist, it did. I don't know what it was.
Hmm.
For all I know, it was a biological weapon,
Hmm.
but it was a real disease process that people got that caused more inflammatory damage than we had ever seen for the entire history of medicine. So
Wow.
the fact that we would deny anti-inflammatories and steroids for the most inflammatory disease process we'd ever seen, that is criminal. Dr. Pierre Corey and the FLCCC went up in front of Congress in March of 2020, presenting them with hundreds of case studies showing that steroids were extremely effective at preventing acute illness and death from COVID. And the CDC and the three-letter organizations refused to implement proper steroid protocols for practitioners across the country. So that was an atrocity that I did not overlook at the time, and I will continue to peddle that it was that it was absolutely crimes against humanity to withhold steroids, to isolate patients from their family, and the administration of remdesivir while suppressing alternative therapies. So
And
remdesivir,
for people that aren't familiar with steroids in the context of inflammation and respiratory distress, that was a common thing. That was the go-to. That was the norm. It was unquestioned. Everybody did it. It was not an issue. And they suddenly, boom, they closed the door and said, you may not treat these patients.
that's correct. And they also refuse to allow us to give patients steroid inhaler treatments like
Mm.
albuterol. That I still just cannot fathom how any rational human being could have gone along with that, because what do you do when a patient is having trouble breathing and they can't oxygenate? You give them albuterol. That has been the gold standard for decades. And so not a single hospital in California would allow any patient to receive albuterol treatments if they were diagnosed with COVID. Uh, that's criminal.
I
That's
mean,
how.
if you wanted to design a system that would injure and kill the largest number of people, you would deny them these tried and true, uncontroversial, standard traditional techniques that are known to work. And then you'd let them get really sick and then terrorize them into accepting remdesivir or accepting being vented.
Absolutely. Send them
Wow.
home, tell them to go home and do nothing. That was criminal. Any practitioner who did that violated their oath. I would never tell a patient to go home and do nothing. Go home, take quercetin, vitamin C, D, and zinc. Stop your system from, take high doses of an anti-inflammatory to stop this inflammatory process from taking place. That's what every single practitioner across the country should have done, as soon as somebody had thought that they had been diagnosed with this, disease of COVID. So that was really extraordinary, and it prepped me for being able to properly identify what I saw when those
Mhm.
vaccines, these, so-called vaccines were released into my community. So in the Bay Area of California, we had one of the most compliant populations in the country. So pretty close to 100% of our adult population went and got these COVID vaccines as soon as they became available, which was the end of February of 2021. The public got access to these shots. So within 2 weeks of the rollout of these shots, I started receiving 3 to 4 phone calls a day from the staffing department at my hospital to come to work because they were so badly understaffed and the hospital was so overwhelmed with patients that they could not manage. So when I did end up going in, what I witnessed completely floored me. And it took me a while to process it because I was so overwhelmed by what I'd seen. So we had this was reported to me by my manager. We had a 300% increase in hospitalizations, and that's directly associated to the onset of these shots. I took care of these patients, all of them. At one point, I worked a double, so I got report on 2 full floors of patients within a 16-hour period. Every single one of those 2 floors of patients, that's about 50 patients, was being diagnosed with either a heart attack, a stroke, a PE, pulmonary embolism, some peripheral clotting disorder that I had never heard of. In that 16-hour shift, I got report on 2 patients with Guillain-Barré. Both of them reported to me that they had received the COVID vaccine within 48 hours of the onset of their symptoms. And in my career as a nurse, I had seen Guillain-Barré in 10 years. I had seen 2 patients with Guillain-Barré. Within a 1 month period of time, I'd taken care of 4 patients diagnosed with Guillain-Barré, which is an autoimmune neuromuscular disorder. It causes failure of extremity strength as well as other
So
issues.
you lose the ability to walk, for
Yes,
example.
that's correct. And
Wow.
it,
So just to get the, if I'm sorry to interrupt, but just so everybody understands this, when COVID was supposedly ravaging the planet And yes, there are respiratory diseases and they are serious. And this one sounds like if it took root in you, you were in trouble. But that did not overwhelm the medical system. The medical system didn't start getting overwhelmed for real until until the injections rolled out.
two
And part of
weeks
the
later.
reasons it got overwhelmed, it sounds like the nurses were all taken out by this vaccine, or a bunch of them. If you have less nurses than you need, and now you have all these new diseases that are cropping up as a result of the vaccines, that's when you're going to have an overload in the hospital. But that did not happen during COVID. It happened after the vaccines. Good
Yeah.
Lord.
So in addition to that, I had two colleagues who I know of, there was probably more, who went into anaphylactic shock after taking their COVID shots. In addition to that, something to know about my hospital, Kaiser Permanente is a full scope of care facility. We had our COVID vaccine clinic on the lower level of the hospital. So when I would go into work, it's very interesting how this all happened. I would go into work when I'd work a day shift, right? 9 to 5 when the vaccine clinic was open. I heard about 10 times more code blues than I had ever heard in my entire experience as a nurse. So code blue is called when somebody stops breathing or their heart stops. And what that does is it's announced on the overhead comms of the hospital to call emergency personnel to the scene to resuscitate that patient. So because the vaccination clinic was on the lower level of the hospital, the overhead comm would go off and they would call a code blue. So I was used to, in the hospital setting for 10 years, hearing one code blue per shift. And you would go, code blue, second floor, level 256. That was the call you would hear.
Gotcha.
So in those hours of 9 to 5, when I was working after the rollout of the shot, I would hear that overhead comm go off, code blue, lower level. Uh, they probably did report the exact room where the
Mhm.
shots were being given. I didn't ever go down there to assess it,
Yeah.
but that was a tenfold increase in code blues, and
And
I knew
it was all
that.
coming from the lower level, which coincidentally was where the vaccines or the injections were being given.
That's correct. So
Unbelievable.
I knew, so in addition to knowing my colleagues, there was another colleague of mine who worked at a nearby Kaiser facility, and she was a nurse who administered the COVID shots. And she right away started noticing a mass increase in anaphylactic shock after administering.
Tell us what anaphylactic shock is for people that don't know, if you would.
So anaphylaxis it's an inflammatory response. So it usually causes inflammation and swelling or rashes. Oftentimes what happens is a person's airway will close and they will stop breathing. So that's when we need things like an EpiPen, epinephrine. You give the
Mm.
shot of epinephrine and the inflammation goes down and the person is able to breathe again. So at the hospital setting, because they were going into anaphylactic shock at the hospital, they would immediately be transported to the emergency room where they would be treated for anaphylaxis. So I suspect not so many people necessarily died from it, but it was
Hmm.
very traumatizing. It was definitely traumatizing to my two colleagues who I spoke to who went into anaphylaxis after receiving those shots. And so this other colleague of mine who worked she was the nurse who administered the COVID shots. She saw a massive increase in anaphylactic shock directly associated within 15 minutes of the administration of the shots. So she would give these COVID vaccines, and then within 15 minutes, the patient would go into anaphylactic shock, and she, legally speaking, uh, part of our job title as nurses requires us to mandatorily report adverse reactions. I was trained on this in college. There's the VAERS database. It's the mandatory reporting system where we're supposed to report adverse events. So when she brought up to her manager, my colleague who was administering these shots, she said to her manager, I am witnessing 10 plus episodes of anaphylaxis per day, and I need to know how we're going to expedite the documenting of
The
this.
VAERS, because it's a process. It's not a 5-minute form.
Correct. And she did not have the time or access to be able to document that effectively. So her manager directly told her that if she reported a single adverse event to the COVID shots, she would be fired.
Mm-hmm. Mm-hmm.
And so that's I heard it with my own ears, the tenfold increase in code blues. And then my colleague from a different facility in the Bay Area who was administering the shots saw the same thing, was threatened by her colleagues, told that she could not report. We were all being threatened. So I brought it up to my colleagues multiple times, to the treating physicians and the administrators of my hospital,
Mm-hmm.
how to report and why we weren't reporting and why we
Mm-hmm.
were administering an antiviral like remdesivir, which was experimental, weeks after symptom onset. Statistically, you're not supposed to administer an antiviral more than 48 hours post symptom onset. And we were 99% of the COVID patients that I would see wouldn't start remdesivir until usually day 8 to day 10. So it was completely contraindicated and it was unethical. And that was the thing. It was like I was being faced with this over and over and over again, were these outrageous, unethical situations where we were being forced to either go along or compromise our employment.
Mm-hmm.
So I ended up standing up, eventually after that situation where my manager had pointed out that we had a documented 300% increase, and I had known that it was directly associated to the onset of the rollout of these shots. I couldn't justify remaining in the profession any longer. So I had legal documents processed and served to my employer, and they fired me within a week.
Wow. About the VAERS system, there was a nurse in upstate New York. New York's a huge state like California, so it's far from here, but it's within our region. And she was trying to assist other nurses and doctors in filing their VAERS reports because they just weren't. And she said, "Look, I'll do it. I'll go through. Just give me the data, and I'll sit in front of the machine because I think it's an online system. So you have to sit in front of the computer. It's an onerous system. It's very difficult. If you're interrupted, all your work gets erased. You have to go back and start from zero." So she was willing to help, to pitch in to make sure these events were being reported, and she was fired for
Yeah,
for, for doing this.
yeah.
Um,
It's so fascinating. The psychology behind all of this is so fascinating. None of it
well,
makes any sense unless there was an agenda. I don't know what else to make of it, you know?
it's so interesting how they managed to get all the hospital administrators who rule the roost at these hospitals. I mean, I guess probably the lawyers are the real behind the scenes people, and then they tell the hospital administrators how it's going to be. And then yeah, my understanding is hospital administrators, they're not doctors, they're not nurses, they're not healthcare professionals, they're not scientists, they're administrators. So why would you give them the ultimate say in how a hospital is run? But in fact, that's what's done. And as we talked about with a lot of the nurses too, is on the doctor's side, there are no independent doctors anymore. They're all paycheck people, most of them, certainly if you're at the hospital. And they have a huge investment, college, medical school, residence, all this stuff. They're in school for, 20 years before they can draw a dime. They got hundreds of $1,000s in medical school bills. And now there they are. And the hospital administrator is telling them to do something. And it was a very few number of doctors that spoke up. That's my understanding. And in the population that did speak up, and it was limited, but the population that did were the nurses. Um, I'm beginning to, I think, I mean, this has made me look at, I mean, I've been looking at medicine, the practice of medicine skeptically for a long time. But this whole experience has made me think of our nurses and how important they are, and how they've been treated like second class citizens within the system is my feeling. I don't know if that's true from your experience. And yet here is one of the greatest repositories of practical clinical knowledge that we have on the planet is the nurses that work closely with patients, not for a minute, but for hours. And, they're the ones that have shown up in the largest numbers from the medical profession to speak out, and it's I don't think it's a coincidence.
Yeah, I
Um,
wish that we would be brought to the table more often.
yeah,
I think that you're correct in that, you know, they're constantly targeting all of the doctors who are speaking up. And,
yeah.
you know, it's almost like they feel like the doctors get more, viewership. But there's a Gallup poll that's been run in the United States for over 20 years now that shows that nurses are the most respected profession in the United
By the
States
public.
by the public.
But is are they the most respected by the doctors and the hospital
No,
administrators? Yeah, there you go.
no, we're not. But when it comes to really helping the public understand what is going on here, you would think that people would pay attention to that kind of call from the public, like, hey, we trust the nurses. But it still, when the rubber hits the road, they're not putting us, we're all screaming from the rooftops and just being censored. I mean, as are the doctors, but um, I could probably get 500 nurses to come in together into a
Wow.
room or an event and, speak about the truth of what had happened
Wow.
with COVID. But nobody, there's no,
There's no venue. There's no
there's
venue.
no venue. There's no money to make
Well,
that go, even though that's what the public would respect. That's
I get,
not what we
yeah.
get.
Sorry to interrupt. I got to tell you a story I saw. This really annoyed me. It was something in DC, and everybody was appearing on the Capitol steps or something. And it was somewhere. And the comedians came out and they did their long shows, and the guitar players came out and they did their long shows, and the would-be politicians came out and they did the long shows. The doctors came out, and then they brought the nurses out, and they literally brought them out, didn't let them speak, and took them off the stage like that fast. And I'm like, you know what? I want to hear from the nurses. I don't really need to hear from the comedian. I don't really need to hear from the politician. Kind of interested to hear what the doctors have to say, but I really want to hear what the nurses say. And even in the resistance, and even at a resistance event, it was to me it was completely backwards.
Yeah.
That's my opinion, but we're going to change it. I'm hoping that the book starts to help congeal this understanding among lots and lots of people that our nurses are very important. They the ones that stood up for us really stood up for us, and they are the ones working to build, not trying, working, because it's going to happen, to build alternative systems that are better, safer, more humane, have better outcomes, and then also to get justice for the many. And, we're talking hundreds of thousands of people, not hundreds, hundreds of thousands of people that were either killed or seriously injured by these mad, insane, anti-scientific, anti-medical, anti-human protocols. So the website for Gail, to follow up with her, and I hope everybody watching this will, is standfirmnow.org. And we've been talking with Gail McCrae. Um, Thank you, thank you, thank you. A million thank yous for not only for this time here, but for all that you've been doing over all these years.
Thank you, Ken. Thanks for having me. And again, I'll repeat, I'm happy to assist or facilitate any criminal charges. Anyone who's building these new systems, I have resources and I am ready to take action. So reach out to me, on my website, and we will be in touch. Thank you, Ken.
Great, thank you.